Okay. I'd like to thank you all for joining us at our second Brainwaves conference, and really appreciate all of our sponsors, and special thanks to my close friend Paul Diefenbach for joining us again this year. I'm going to actually not talk about transposition and interposition, but rather I'm going to talk about hypertension, which, as you know, is multifactorial and poorly understood, but importantly, it affects almost half of the U.S. population. And what is termed resistant hypertension, which by definition means that you are uncontrolled on 3 or more meds, so your blood pressure is greater than 130/80, or you are on 4 hypertensive medications. And we know that the central nervous system is directly involved in the regulation of blood pressure. And for many years, there has been this neurogenic hypertension hypothesis, which was put forth by one of my mentors, as well as Dr. Barker's, one of his mentors. And I thought it might be an appropriate time to present this article, present this data, which will be published in the next couple of weeks. And so you can see here from his first publication, Dr. Janetta operated on 53 patients, and he came to the conclusion that, that some of them had hypertension due to neurovascular compression of the left lower brainstem. As you can imagine, this information, which I think was first published when I was about 5 years old, was controversial. So much so that I think it probably spelled the end for Peter Janetta at the University of Pittsburgh with the dean of medicine there, because he thought this idea was just absolutely hokey. And in any event, when they published this first paper, all of the hypertension patients in the series were evaluated by internists at Presbyterian University Hospital at the University of Pittsburgh. And they were given a diagnosis of essential or neurogenic hypertension, but they, the criteria used to make that diagnosis was not as rigid as we would expect today. So why am I talking about this? Well, when after this first report, there was, as I said, a number of individuals who felt that, you know, this is just crazy, but there were a number of surgeons who took this up and began to perform decompression of the lower left medulla. And in fact, when I was both in training and early in my practice with Peter Janetta, I did perform this operation many times. And there's been about 15 studies since this, some in very high impact journals, which have suggested, about half of which have suggested that there is a significant correlation between neurovascular compression and hypertension of the lower brainstem. However, most of those studies are a bit flawed. So in Dr. Janetta's initial report, these patients just came from typical cranial neuralgias and some other cranial nerve problems. And these were the vessels in question. So most commonly it was pica and, as he said, branches thereof. These are what the patients look like in that series. Now, these patients were not tested, let's say, with home blood cuffs, 24-hour monitoring. But, so I guess what I can say to you is that through maybe the 90s, there was some real interest in this, different groups publishing, and then it just kind of died, and people started to say, there's just nothing here for the most part, although I'll show you one paper where they did operate on a lot of patients. It was just published in the Journal of Neurosurgery, I don't know, 7 years ago. But there is an increasing interest in the medical community regarding the posterior circulation and hypertension. This is a paper from Circulation Research. I encourage you to read it, but the idea is that there's like a stealing phenomenon in the posterior circulation in some patients, that the brain then, or the brainstem, causes higher blood pressure to be triggered to try to perfuse the brain. Now, this paper, as I mentioned, was published in 2015 by Mark Sindhu, who really to this day still believes that neurovascular compression of the left lower medulla, as Peter Janetta suggested, is one of the causes of essential hypertension. And I'm not going to go through the entire paper, but you can see here he made this case just 10 years ago that this really argues for considering MVD for the treatment of hypertension. But again, if you look through this paper, you'll find that how they categorized hypertension would not be, let's say, accepted in the hypertension community. So when I was still at the University of Pittsburgh a few years back, I was approached by what was then called the Janetta Neuroscience Foundation after Peter Janetta's death. And they had about $600,000 left. And they came to me and said, you know, we'd like to give you some monies to study a problem that would have been of interest to Dr. Janetta. And, you know, Dr. Janetta, he had some really interesting ideas. One of them was that compression of the right lower brainstem was the cause of diabetes. And towards the end of his career, he put forth that compression of the midbrain was the cause of Parkinson's disease in some patients. And, you know, he's an interesting figure because on the one hand, many neurosurgeons revere him, and on the other hand, people say, well, some of his ideas are crazy. I think that, you know, I like the fact that he's swung for the fences in some ways, but I always wondered, you know, what is there about this hypertension thing, and is there anything to it? So, and I want to thank our medical student, Mindy Christ, who helped me put this talk together. She's really doing a great job this year. So, I pitched this idea to them about putting together a prospective study, and I did some calculations. I said, I think it will cost, you know, this much money, and I knew that really I didn't know anything about hypertension. So I engaged a fellow named Matt Muldoon, who is the director of the Malignant Hypertension Center at UPMC and has been funded through the NIH for 3 decades, as well as a guy named Dick Jennings, who's been funded for 4 decades through the NIH for his work regarding the psychological effects of hypertension, because both of these guys had actual hypertension patients that they had studied. And if you get into this work, you'll find that's very difficult to find true resistant hypertensive patients versus controls. So we began enrolling in 2018, and it took us through 2022 to complete enrollment. And this was just an imaging study. So we were putting these patients through a 3 Tesla study to look at vascular compression of the left lower medulla. The patients were aged 30 to 70. And this was really rigorous. I mean, we had blood pressure cuffs fitted for each patient. They had office readings, 24-hour readings at home. And these were ultimately screened from 68 participants. And we had 2 neuroradiologists who've worked with me for years, who did know the hypothesis of the study, but they didn't know which side to look at. I didn't talk to them about that. So they graded both sides, and they actually named every blood vessel. So they named the vertebral artery, pica, ica, and where it was located. And we graded that in this manner, which is kind of the accepted grade. So top A is no contact, B is B is contact, C is compression, and D is distortion. So it actually cost about $100,000 to complete this study. And at the end, we had 24 normotensive patients and 12 with verified resistant hypertension. On average, our resistant hypertension patients were taking more than 4 meds, and their average blood pressure on the medications had a systolic BPs greater than 30, more than the normotensives. And this is a little bit hard to see. I apologize, but this is the demographics of the study, as well as the vessels that we looked at, and these were the results. So we did not find any significance to compression of the lower brainstem. That's kind of interesting, though. So I was working with these 2 medicine doctors at UPMC, and they keep looking at the data, and they keep saying, I mean, I kind of knew this. I went through and read the images myself and looked at them, but didn't. So I knew there was nothing here in this study, but they kept trying to find significance. So it's kind of remarkable. But I said, let's just publish the data. Well, that's hard to do. I went to Sander and I said, what do I do with this null hypothesis? He goes, I don't know, you could try for this, So we did get it published, or will be published, in Hypertension. And, this is the first prospectively designed study where the patients were really well characterized as resistant versus normotensive patients, and we found no significant difference in vascular compression of the rostra ventrolateral medulla. So, is that the end? I don't know. There's still, the dorsal motor nucleus is there, and maybe you could stimulate that area. I don't believe the cure is going to be through some sort of decompression. But I still applaud Dr. Janetta for kind of swinging through the fences. I'd like to thank everybody I worked with on this project, and I can take any questions.